program consists of two different kinds of information. One of them is lecture or presentation information, and every day there will be a presentation. So on some days maybe two presentations that are helping people to understand the dynamics of their illness, how they can get better control of their health overall, and a few of the basic principles of nutrition. We're not going to go into detailed biochemistry, but everybody should understand a little bit about how different foods affect them. And so we're going to present that kind of information on a daily basis. Also on a daily basis there will be sessions in the kitchen, and these are hands-on sessions. We have a very beautiful cooking school here at Penningham with 12 individual cooking stations, so it means that everybody in the program gets to actually prepare food for themselves in the program under supervision. So people really, when they leave, they really know how to prepare that food so that they're able to create dishes that are healthy, but also that are delicious, because let's face it, if the food doesn't taste good, you probably won't continue eating it. Right? The next factor in the program is the exercise program. And what we will be doing is we will be doing some things that are group exercises, and these are exercises that are based around yoga, tai chi, aerobics, not anything that's going to stress or strain somebody, but what we want to do is we want to find out what's the best kind of program that's going to suit an individual. We also have a full gym here, and so in a supervised way, everybody will have the opportunity every day to go into the gym, right, and do a sequence of exercises for themselves. And many of these exercises are really to get people back into a particular level of fitness so that they can do the other things that are self-generated and don't require going to a gym and do them more effectively. And then we have some elements of the program that are just based around relaxation. We think that it's nice for people to have massage, and so we use shiatsu massage, which is a therapeutic massage, but it's not one that you end up screaming in pain when you have. Shiatsu massage is very good for getting the energy going in the body, for increasing blood circulation, lymph circulation. And so sessions like that will happen throughout the program, and you'll have enough time to go out and just enjoy the atmosphere here. Penningham sits in a beautiful garden space, you know, and there are many places, outdoor places here where people can go for walks or hikes. That's dependent on you, right? And so the program is a program that's meant to have results and to teach you new life skills, but it's not so rigorous that you're going to be tired out at the end of every day. The focus here is really teaching people how to operate once they do go home, how to create the life skills that they need so that they can be successful. And we're a backup for that, so that when people leave here, they leave with a very, very specific program. They're even leaving with a basic dietary food pack to take with them to go home. They help them through the first couple of weeks. So we're really setting people up for success. And then they can come back to us via email or via phone and ask the questions that they need as they address the real life situation, being in their own home environment. The principles of health are very, very simple, and sometimes they're made more complicated, and usually when they're made more complicated it's because they're made complicated to make somebody look smart. The way that we approach the whole program is very practically oriented, so that it's teaching practical life skills, how to cook your food, how to select the food that you eat, how to create an exercise program for yourself that really works, how to get yourself into the mental state so that you really feel confident in moving ahead and following a whole new life health program. And that's where we're really aimed at. We're not aimed at an academic goal here. We're aimed at a practical goal of each person improving the quality of their health. We do have a cooperation with Dr. Martin Ennis, who's an old associate of ours, and What Martin is going to be doing is he's going to be reviewing everybody's health records at the beginning of each program and taking blood and reviewing the person's health history with them. After that, he will check midway through the course, and again at the end of the course what we'll do is we'll take blood again, and we want to provide people with an objective way of judging the success of what they're doing. We know that subjectively people are going to feel better when they're involved in the course. In terms of controlling blood sugar, we're not going to do anything radical, and the regulation of blood sugar is going to be up to the individual. It's not up to us, right? We're going to let people make those decisions, and we're going to help educate them as how they can make those decisions in an intelligent and safe manner, right? So yes, we have medical supervision, but there's not going to be any need for 24-hour medical supervision. This is not boot camp, right? Everybody can make their decisions on their own. We want people to succeed. The more people succeed, the better it is for everybody, and the better it is for us, because then you're going to be telling other friends that you have that you've been successful in the program, and they're going to see the results of the program in you and your general well-being.